And welcome back to Scissors and Scrubs. I'm Nicole.
I'm Laura.
Laura is currently half dead, so if it sounds like seals barking in the background,
I'm sorry.
it's just Laura. She
Yeah,
can't
try
hear me
not
either,
to.
so you might hear a lot of what. It's like when you're talking to my aunt, I'm Johnny 2 times. What? I have to keep repeating everything twice.
Yeah.
Yeah.
Yeah. Completely blocked.
Yeah. This is good. So it's going to be a great episode. It's going to be great. We get creative. We come up with weird shit.
Mm-hmm.
So Valentine's Day is coming up, or as my kids used to say, Valentine's Day.
I think adults still say that.
I know, it's just there's certain words adults say: lie, berry, Valentine's, underwears,
Ambulance, if you can.
ambulance. Kind of makes me nuts. So it's going to be Valentine's Day. And instead of talking about, I don't know, venereal diseases like we have in the past, or love lost or heart diseases, we're talking about how much we love our pets and the things they give us that can kill us.
Yes.
You know, we like to do a little twist here or there. So happy Valentine's Day. You got a big box of chocolates, and it's going to be whatever we decided to pull out today.
A little side of psittacosis.
We're going to top that cherry with a little cat scratch fever.
Yeah.
All right? Do you want to start since you can't hear shit?
Yeah, I can.
Okay.
All right. I'm not going to be able to say any of these diseases, just FYI. We're going to start with psittacosis.
I've never even heard of this.
Me neither. Psittacosis is a disease you get from contact with birds infected with chlamydia psittaci bacteria.
How does a bird get chlamydia?
Well,
can I just... you don't have to worry about it because I'm never coming in contact with a bird.
Ever.
But
it usually infects your lungs, and it causes symptoms like fever, cough, and muscle pain. It sometimes causes serious lung infections or spread to other body parts. Antibiotics can cure most cases of psittacosis. It's a bacterial infection. Psittacosis is also called ornithosis or parrot fever, though you can get it from many types of birds, not just parrots. Psittacosis is caused by a different bacteria species than the one that causes chlamydia in humans. It is not the chlamydia.
I mean, I thought for doing STDs, like we're just wrapping it all up together.
Not the chlamydia people get. It is a completely different bacteria. It just has a similar name. Symptoms of psittacosis in humans can be mild or severe and include fever, cough, muscle pain, headaches and body aches, nausea and vomiting, diarrhea, and less commonly a rash. The bacteria comes out in an infected bird's poop and respiratory fluids. When these fluids dry, they can release the bacteria into the air as dust. It spreads between birds.
Birds are so dusty, too.
Yeah. It spreads between birds, the contaminated dust, or direct contact. All types of birds can get and spread psittacosis, including birds kept as pets like parrots, parakeets, cockatiels, and cockatoos, farm birds or fowl like chickens, ducks, geese, and turkeys, and other wild birds like pigeons and gulls. So it's not just like a wild bird, pigeons on the roof. It's your birds in your house, which is awful.
Pigeons on your roof.
They're the ugliest. They're the worst. You get psittacosis from close contact with infected birds and breathing in dust contaminated with their poop or respiratory fluids. Less commonly, a bird can infect you by biting you or touching their beak to your mouth.
This is like you see on TikTok, all these people with their birds. Okay? With their birds.
You watch different things.
No, like there'll be like pets and the birds dancing and this and that.
Oh.
And I'll tell you, my biggest fucking fear with those birds are those beaks. And I'm waiting for one of them to take a chunk out of your face or rip your ear off or knob a finger. They snap fucking almonds with their beaks, but I'm going to let them near my face. Yeah, I'm good.
But can spread it by biting you or touching their beak to your mouth.
Well, because you know they go,
That's
little birdie,
disgusting.
it's a pretty bird. Yeah, no. Or when they let them fly around the fucking house, it stresses me out.
You're at a higher risk for psittacosis if you have a job or hobbies that put you in close contact with pet birds or fowl, like working on a poultry farm or in poultry processing, in a veterinary office that treats birds, or in a pet shop that sells birds. No, just don't go near birds.
I've always thought my whole life birds were just dirty. They're just dirty.
Like
dead bird in the street, don't get near it.
Where they fly. What are the complications of psittacosis? Pneumonia, myocarditis, endocarditis, which are both infections of the heart, encephalitis, which is inflammation of your brain, hepatitis, which is inflammation of your liver, and acute respiratory distress syndrome, or ARDS. Psittacosis can be hard to diagnose from body fluid samples. It can also take a long time to grow the bacteria to confirm the diagnosis. So providers usually diagnose you based on your symptoms and history of bird exposure. Like, oh, I have 18 birds in my house and I have all of these symptoms. They're like, you probably have psittacosis. But they can take samples to send to the lab to look for the bacteria from your sputum, your blood, and mucus swab from your throat or your nose. Antibiotics can cure psittacosis. Usually they give doxycycline or tetracycline. If those don't work or you're allergic to them or something, they can give erythromycin, azithromycin, chloramphenicol.
Something, yeah.
And rifampin. Why is that? What is that third one? To prevent psittacosis, if you're around birds, you can reduce your risk by practicing safe bird handling and cleaning habits.
Safe bird sex.
Including washing your hands thoroughly with soap and water after handling birds or cleaning up after them. Always, even if they don't have this, birds have a million other diseases.
And all
don't
that
touch them and
dust that comes off of them.
Wash your hands. And you should be wearing a mask if you're touching their poop. Buying pet birds only from reputable sources. Isolating infected birds from other birds. If you have one bird that's sick, you can't let them near the other ones because they're all going to get it because the poop goes in the air. And not crowding too many birds in one cage or enclosure. Set up bird cages or enclosures to avoid spreading infections through contaminated food, feathers, and poop. Yeah. If you have all those birds, their poop's going to get in the food, and then they're going to eat the food, and then they're all going to get it. Don't stack cages and use solid barriers between cages that are next to each other. Most people with psittacosis will make a full recovery if treated properly.
I had been watching one of these like mysterious diagnosis or something, and this woman starts getting like flu-like symptoms. She's having trouble breathing. She ends up in the ICU, intubated. She's dying. And some resident comes in and he's like, "Do you have birds?" And she's like, "What?" He's like, "Do you have birds?" And she was like, she had to write it down because she's intubated. She raised pigeons.
Oh.
And they were killing her. Yeah. He's like, this is because of the birds.
People get seriously.
Yeah, she was dying.
Need lung transplants.
It took forever them to figure out it was goddamn birds.
Yeah.
Birds. Nope. They're adorable, cute in somebody else's house. I don't want them in my house. No. I don't want them dancing around my cats. I don't want them flying around. My girlfriend, I love her to death, and I would go to her house and she'd have a parakeet and it'd be flying around the house and I'd be trying to talk to her and I'd be like dodging that bird. And I'd be like, I can't concentrate with you because this bird's flying around the house. It's freaking the shit out of me. Like, can you put it back in the cage? I don't like flapping sounds of birds. It stresses me.
I wouldn't go to that house.
I went.
Did you eat there?
No.
Okay.
The birds flying around?
Yeah.
You could be shitting in the salad. I don't know. All right. Well, we're moving on to cat scratch fever. Ted Nugent's infamous words.
Is that literally a song?
Mike, is that literally a song? Yes. Ted Nugent, cat scratch fever. Thank you very much. Wow. Yes. He's one of the two things I think of when I hit cat scratch fever. The other one is the nurse that we worked with that had it twice.
Yes.
All right. What is it? Cat scratches and bites can cause cat scratch disease. It's a bacterial infection carried in cat saliva. It suggests a cat may get these bacteria from fleas or their own droppings. Why cats are doing that, I don't know. Well, I guess they lick their ass. Kittens younger than 1 year.
And then you let them lick your face, you sick people.
Kittens younger than... I don't like a cat licking my face. I don't like a cat licking me because their tongue is not like a dog. It's like...
Anything shouldn't lick you. Well, they lick their bums.
But a cat, it's like having somebody drag sandpaper across your skin. No. It's not a nice feeling. So I'm always like, oh, no. Kittens younger than 1 year of age are more likely to have the bacteria in their saliva and are more likely to scratch a bite because of kittens, which means the increase of the risk is through younger cats. Okay. It is caused by a bacterium in the saliva, and it is passed from an infected cat to a human after the cat licks an open wound or bites or scratches human skin hard enough to break the surface of the skin. Factors that increase your risk are being around cats on a routine basis, especially kittens that are more playful and apt to accidentally scratch you. But kittens are so cute. Not cleaning scratches or bites from a cat as soon as you get them. Well, that's just not smart. No. Allowing a cat to lick an open wound that you have. That's not smart either. You don't want any animal licking your open wounds. You shouldn't lick your open wounds. The only thing that goes on an open wound is an antibacterial.
Yeah, stop letting things lick
Why would you let an animal lick your open wounds?
No.
Or being around a flea infestation.
No.
What are the symptoms, Laura, of cat scratch fever? Well, You can be reddened or swollen within a few days, and it does not heal or it worsens over time. Usually you'll see that red line. If you always get scratched in the hands, you'll see that red line jet up their arms. Painful or swollen glands, especially under the arms, if you're scratched on that arm or hand. Or in the groin, if you're scratched on that leg. Flu-like symptoms including a headache, decreased appetite, fatigue, joint pain, and or cat scratch fever. A scab or blister filled with pus at the scratch site. They may look like other conditions or medical problems. You're going to go into the doctor. When you go to the doctor, he's going to do a complete history, including have you been scratched by a cat or kitten, a physical exam, and a blood test or lymph node sample. The treatment depends on your age and health. It will also depend on how severe cat scratch fever is. It may include antibiotics to treat the infection, care for the symptoms that result from the infection, as in your fever. And in most cases, there aren't antibiotics needed. It will clear up on its own. I find that kind of hard because I've seen people get really sick. If I had an infected
wound.
Well, I just see people get really sick.
Give me an antibiotic, please.
People whose immune systems are weak, such as HIV and AIDS, or getting chemo or diabetes, can have complications such as bacillary angiomatosis, which is a skin disorder that causes red, elevated lesions around surrounded by a scaly ring. It can become more widespread and involve your internal organs. Paranoid oculoglandular syndrome. It causes a red, irritated, and painful eye, like pink eye. It also causes a fever and swollen lymph nodes in front of the ear on the same side. Endocarditis, which is a heart disease, which we've talked about already. Can it be prevented? Stay away from cats.
Yeah, that's what I do.
When should I call my healthcare provider? When your symptoms show up. Cat, it is a disease. It's an infection caused by the bacterium in the saliva. It causes redness and swelling at the site of just as a reminder, it causes redness and swelling at the site of the scratch or bite. You can have flu-like symptoms. So if you're having any of these after you've been scratched by a tiny, cute little kitty cat, then you need to go to the doctor. And that's about all I have to say about cat scratch fever.
When I worked at another hospital, we had this young 20-year-old guy coming in, and they're like, we got to do a lymph node biopsy. We're pretty sure he has lymphoma. He's really sick. Blah, 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 blah. We took the lymph nodes out of his groin. They're like, yeah, these don't look good. It's not good. Blah, blah, blah. And I'm like, oh my God, this
he's kid young.
20-something-year-old's going to die of lymphoma or, at least have to go through
such a joyous job we have.
such terrible treatment or whatever, blah, blah, blah. The next week, the doctor comes in. He's like, he has cat scratch fever. I'm like, what? They're like, he had cat scratch fever. He's fine. And I was like, oh my God, thank God. Like,
I mourned him.
This kid
started a Facebook page.
He's going to be on key. Like, I'm thinking these terrible, terrible things. And it was cat scratch fever.
Oof. It's not. It's like people think it's a joke. It's not.
No, he was sick.
I will say, my babies have never scratched me. Never. One I've had almost 14 years. He's never bit or scratched me. He doesn't even lick me. He only licks himself. Ew. The other one likes to try to get up and eat on your ear, but he also has never scratched me or anything. He's my love. My babies. So we're not going to talk bad about my cats.
Sure.
All right, so go ahead.
Okay, I got another bird poop one.
Oh, you and the bird poop. For somebody who eats burbs so much. Burbs.
I do. You gave them to me. Okay, I'm just going to call this crypto, but it's cryptocurrency? Cryptococosis. Yes, cryptococosis.
Good thing we have a medical history background here that we know how to pronounce these words.
It's like too many. Look at all the O's and the C's.
Did you ever see me in pharmaceuticals when they would have all these words like carbodio, flyo? I'm like, what the? No, I was not good with it.
This is going to be crypto from now. Crypto is an illness caused by a fungal infection in your lungs, brain, or other parts of your body.
You don't want a fungal infection anywhere.
No. It's caused by the infection. It's caused by infection with cryptococcus fungi in your brain and lungs. It can, again, also spread to other parts of your body. When you have this crypto infection in your brain, it's called cryptococcal meningitis. It can cause fever, headaches, and neck stiffness. In your lungs, it's sometimes called cryptococcal pneumonia or pulmonary cryptococcosis. It can cause you to cough and feel like you can't breathe deeply enough to catch your breath. Maybe that's what I have. Different types of
cryptococcosis.
I'm also doing this to try not to cough, and it's very to get these out and try not to cough. Different types of cryptofungi make different people sick. Crypto neoformans usually only causes people with weakened immune systems to get sick. So if like
HIV,
you were to get
diabetes.
it, you wouldn't get sick from that one. But other people, yes. People that undergoing chemo or whatever will get sick. Crypto Gotti can make you sick even if you have a healthy immune system. Symptoms and causes. That depends on where the fungus infects you. Lung infections can cause pneumonia-like symptoms. And central nervous system infections can cause meningitis-like symptoms. Disseminated crypto causes symptoms in many parts of your body. Lung symptoms are cough, shortness of breath, chest pain, and fever. Central nervous system symptoms are fever, headache, neck pain and stiffness, nausea, vomiting, and sensitivity to light. They say it mirrors meningitis.
Oh.
So they might
Neck
think you have like
pain.
regular meningitis. Like you can't touch your chin to your chest.
And this is from birds?
Bird poop.
Ooh.
If you have disseminated crypto, you may have lung or central nervous system symptoms as well as skin changes. You may notice thick or hard patches, rashes, sores, bumps, and blisters. The cause of it is the fungi Crypto Gotti and Crypto neoformans, called cryptococcus. They live in the environment.
Cryptococcus.
These fungus just...
That's what I'm going to name the bird that's giving me this. Hey, coccus.
Yeah. The fungi lives in the environment, in dirt, like soil, on trees, and in bird poop. Bird poop is disgusting.
Birds. I'm not going to say disgusting because maybe someone out there has a big old cockatoo in their living room that hangs out with them, but it's not for
disgusting.
me. They're not for me.
I don't care. I will tell you, it's disgusting. Gotti and neoformans are found like all over the world, but the C. Gotti, which can make all of us sick, is commonly found in Australia, British Columbia, and Canada, the Pacific Northwest in the U.S., and Southeast Asia.
Yet another reason not to go to Australia.
Mm-hmm. You get crypto from breathing in the fungi from the air. So it's not like you're digging in the dirt, but it's the particles that's in there.
It is spored.
Yeah. You can't see it, and it's hard to avoid if you're in an area where it's common.
Ugh.
Most people breathe in the fungus without having symptoms, but in some people, the fungus grows in their lungs or travels through their body to their brain, making them sick.
This is a gross episode.
Sometimes you can have the fungus in your lungs for a long time, but it only grows and causes symptoms when something like an illness or a new medication weakens your immune system. So it could be living in there, not doing anything, and then it grows and
colonize.
Complications. Some of them can be serious, especially if you get it in your brain. You can have increased intracranial pressure. This is extra pressure from too much fluid around your brain, which can then compress your brain. And we know that's very dangerous. Partial or complete blindness, eye disease or inflammation, weakness in the muscles that control your eyes, relapse, so you can have it, be treated for it, and then you can get it again. Immune reconstitution, inflammatory syndrome, or IRIS. It's a condition where your immune system overreacts after treatment. It's like a rebound illness, and people get wicked sick with it. They diagnose this by testing your tissues or body fluids. For the fungi, they may test your blood, your cerebral spinal fluid, or your sputum. They'll also use your symptoms, medical and travel history, and imaging to diagnose you. And depending on your symptoms, you may get chest x-rays, CAT scans, or MRIs to look for changes in your lungs or brain.
You're my one lung.
Yeah. Providers use antifungals to treat crypto. Mm-hmm. The specific treatment depends on where the crypto is and your immune system. Specific medications and procedures that can treat crypto include fluconazole, amphotericin B, flucatosine, corticosteroids, surgery to remove large masses of fungus, which are called cryptococcus.
Cocomas. Unamas. Cocomas.
Therapeutic lumbar puncture or shunts, like they might have to put a VP shunt in your brain if you have too much fluid.
Now. This is just getting ridiculous.
If you have
this is just
increased intracranial pressure, you need a VP shunt. It can be hard to avoid breathing in the crypto if you're in the area where it's common. If you're at higher risk from getting sick from the crypto, like if you have a immune system problem, you're on chemo, you're on immunosuppressants, they have targeted screening. Before beginning HIV treatment, a provider can test you for the crypto antigens Even if you don't have any symptoms, if you test positive, they treat you for the crypto to prevent you from getting sick from the fungus that already lives in your body before giving you treatment.
Thought of a fungus living in my body.
I know.
It's just nauseating.
And if you're at high risk for crypto, your provider can treat you with antifungal medication prophylactically. And this can help you prevent you from getting sick if you were ever exposed to it. Antifungals usually cure people with healthy immune systems. The mortality rates for treated crypto in North America, including the U.S. and Canada, are estimated at 20% mortality.
Wow, that's pretty high.
Yeah. But in parts of Africa, it's estimated to be as high as 70%.
Wow.
Because people in economically disadvantaged parts
Don't
of the
have
world
the same healthcare.
often have higher mortality rates for many diseases.
Well, that was a real shining note on the end of that one, Laura.
Nice. Well, just saying.
Well, when I was a kid, I remember watching Old Yeller, and he gets rabies.
Oh my God, that was the saddest movie I've ever seen
Don't
in my
you
whole
ever
entire
really
life.
wonder what was wrong with Disney? Think about him. Dumbo, mother's in jail. Bambi, mother's killed. Old Yeller, the best part of the whole movie. Kid has to shoot his own dog.
He did have to shoot his own
Like,
dog. It was so
what
sad.
the fuck was he writing for little kids? They wonder why we're all screwed up. This is the shit we were watching.
We learned lessons.
Cinderella's
Maybe our
getting the
kids should have watched
shit
that shit.
handed to her by her evil stepmother. Like, and really no revenge at the end. Really no.
Maybe
Her
our
and her
kids should have watched it. Maybe we should have made them watch it.
Maybe.
Look at, this is what you have to do.
Yeah.
Shoot your own dog.
The moms always die. It's just terrible. So
you
anyway,
might have to live without me. Figure it out.
right. Figure it out. You're going to have to get out of the woods by yourself. So fascinated by that. To Kill a Mockingbird. I was terrified as a kid. The dogs at the end of the street get fucking rabies. He's all...
Rabies was all over the
It
place.
scared it was like quicksand. Like I always thought I was going to walk out and get attacked by a dog with rabies from these fucking movies.
And then fall into
And he had to come home, and Atticus has to shoot the dog with the rabies, and everybody's freaking out. There's a rabid dog in the street. So rabies has fascinated me. Look, I sent Laura into a coughing fit. She has kokomas.
Just call it crypto.
Cryptococcus. It's been all that bird poop she's been licking up.
Oh.
Licking off her car.
Can you imagine?
So I have been fascinated with rabies my whole goddamn life. And then I get to nursing school, I'm taking micro, and we do a whole section on like how they came up with the rabies vaccine. And it's like, what is it, ground up like rabbit?
It's disgusting.
It's like crazy what
Yeah.
it is. I was like, this is fucking, it's ground up spinal cord of an animal, but I think it's rabbits.
I want to say it's rabbits.
And yes, it's weird shit. And I don't know if the rabbit's infected with rabies when they do this. I don't know. And now we worry about skunks and raccoons with rabies.
I had a bat fly at me the other day in the middle of the day. On Death Valley.
Rabies. This is what I'm talking about.
Did it touch you?
It was,
Did it touch you?
no, it came very
You're avoiding that question.
It,
came very
Laura, this
it did
isn't
touch me.
a cold. You have rabies.
That's
And now I'm going to have to shoot you in the backyard.
I'm not gonna be happy.
And then I'll bury you under the red fern.
with
Two different
red
movies.
fern
I know. These movies were terrible.
I didn't see that movie. I just read that book, and my
Oh,
mother
I saw
came
the movie.
upstairs, and she's like, "What's wrong?" Because I was in my bed and I was hysterical.
Yeah.
I was like, "This
Where the
is
red
a
fern
salad
grows, yeah.
book."
Sobbing. I literally can watch humans die in front of me, but when it comes to animals, I'm a puddle,
Mhm.
an absolute puddle. So, in case you haven't guessed, I'm talking about rabies because
Oh, what?
I'm fascinated by them. It is fatal. Did you know rabies is fatal?
Yes.
But preventable.
Yes.
It's a viral disease. It can spread to people and pets through bites, scratches from an infected animal. Spit.
Oh, it's the spit that
It's
does
the
it.
spit, the foaming at the mouth. Rabies can cause severe disease and death if urgent medical care is not sought after a rabies exposure. The virus is fatal if rabies-related medical care called post-exposure prophylaxis, or PEP, is not started before the symptoms begin to show. And I've heard that the treatment is pretty fucking rough.
Yeah, I heard it's not good.
It's rare in the United States with only 1 to 3 cases reported each year. That's not rare enough for me. Okay?
This pretty rare. 1 to 3
One human getting
cases.
rabies is enough for me because I'm terrified of it. Each year, about 60,000
3.
Americans receive PEP following an exposure, i.e. a bat flies at you during the day.
How close did it get?
You should go and get some PEP.
When you say close, like, are you exaggerating? Like,
There's a little spittle on the side of your mouth. I'm getting a little concerned. There is not.
like, did it get? How? Like, literally, like, put your hand out
Your bottle.
to where
Why
you
did
are.
it fly at you? He's all confused, rabbit.
We saw it.
Was he
We
foaming
thought
at the
it was
mouth?
Like a hummingbird or something? 'Cause it was
In the middle of the desert? You thought it was a
I don't know
hummingbird?
what it's
Could
looking
be.
at
The
bats.
cactus might be in bloom. I don't know.
And then someone's like, "Oh, that's a bat," and then he turned and he started flying towards me.
And he's like, "And that's
His face
Mike."
and his wings, and I was like, "That's a bat."
Yeah. I've had them in my house. I know. It's terrifying. All right. There have been no confirmed instances of human-to-human transition, which means when Mike starts biting Laura, she probably is not going to get the rabies.
Thank God.
But aside from those attributed to organ and tissue transplantation, so if I donate my kidney to Mike and I have rabies, I can give him rabies with my kidney.
Oh.
It is transmitted through direct contact with infectious tissues or fluid. The mouth foam. He's just spitting everywhere and you've
So
touched
when
it.
we're doing surgery and they had rabies and we got like a needle stick, we could get it
Oh,
then?
maybe. And then you'd have to get all those shots in your stomach.
I don't want that.
It is not transmitted through contaminated objects or materials such as clothing or bedding. Does not say anything about needles. Healthcare workers providing care to patients with suspected or confirmed rabies should protect themselves by using standard precautions, which we already know. Healthcare workers caring for patients with rabies do not pose a risk to their families or community. People and pets can be exposed to rabies through bites and scratches from animals infected with rabies. In the U.S., it is mostly found in wild animals like bats, raccoons, skunks, and foxes. I'll bet you that coyotes have it too. But in other countries,
They like
dogs...
eat the foxes, don't they?
Huh?
They like eat those foxes and stuff.
They definitely eat skunks and raccoons. I haven't seen a skunk in my neighborhood in about 7 years, but I've seen about 5 million fucking coyotes. Those things are big too. My girlfriend was watching the house. She's like, "I think there's wolves on your street." I'm like, "Swampscott."
They look like wolves,
Yeah.
though.
I'm like, but Swampscott doesn't have wolves. We just have really well-fed coyotes. But in other countries, dogs are still a carrier. It's crucial to inquire about recent contact with wild animals if a patient has been scratched or bitten, or if they've traveled to somewhere where dogs carry rabies. They are spread when an affected animal, usually wild, bites or scratches other animals or people, i.e. your dog or cat. It's usually carried in saliva or mucus and spreads through broken skin. After you have been exposed, the virus must travel to the brain before it can cause symptoms. The time between exposure and the appearance of symptoms is the incubation period, and it may last for weeks or months. The first symptoms of rabies may be like the flu, including weakness or discomfort, fever, or headache. There may also be discomfort, prickling, or an itchy sensation at the site of the bite. These symptoms may last for several days. Usually, severe disease appears within 2 weeks of the first symptoms when the rabies virus can cause brain dysfunction. Common signs include anxiety, confusion, agitation, and hallucination. One clinical sign of rabies appears. The disease is always fatal, and treatment is typically...
What?
Yeah, so once it's hit your brain and you are showing
Once you're doing hallucinations,
anxiety, confusion, agitation...
You're gonna die.
You're done.
there's no
And I had
chance.
heard that. Like, that's
I didn't know
why
it was like always
it's
fatal. Like I knew it was fate. Like,
nearly always fatal.
Shit.
So I think that's why it is so important that if you even suspect you've been...
I'm like, just go. Just go.
How long does it take?
2 weeks.
Well, we'll know in 2 weeks.
If there's even a suspicion, you have to go, because I did know once it hit your brain, you're done. Most rabies exposures require medical attention quickly, but they do not require an immediate trip to the ER unless the wound needs immediate medical attention. Did it bite you, Mike?
I have zero.
All right. It didn't shit
It
on your
didn't
face.
spit on you.
All right.
It didn't come
lick
close
your
enough
ears.
to spit at you.
I think you're good. It has to be direct contact, so I think he's good. A patient should be immediately assessed for rabies-related care in the following cases. They have had direct contact with bats, unless a bite or scratch can be definitively ruled out, which we have done. He has not been bitten or
We've
scratched by a bat.
definitively ruled it out.
They,
Questioning.
they had exposure to certain high-risk animals, which typically include bats, raccoons, skunks, foxes, and mongoose.
Ew, that's the worst one. I'd rather be bitten by any of them other than a
All right,
mongoose.
We're going to pause right here, okay? The other night, we're at work, and Laura's at the desk. We're all sitting around. We're talking about animals. And I talked about how one of the things I would love to do is have a polar bear drugged so I could pet it.
Because she's
And Laura
insane.
proceeded to tell me they were the ugliest
They are
animals on
the
earth. They have this long neck.
You're picturing a Coca-Cola polar bear, which is
I'm
completely
picturing
different.
polar bears with their ding-toed feet and their little eyes. They're so fucking cute.
Yeah, ugly as sin.
They are not ugly as sin. So then that got on to other animals, which every animal in the world she thinks is ugly as
no,
sin.
there's a couple.
And we brought
cute
up
animals.
mongoose, because they're in Hawaii, mongoose have proliferated. And then she pulls up a picture of a mongoose. She's like, "This is disgusting. Why would you think this is she's cute. I'm like, look at him. He's really kind of cute.
They're so I would literally rather be bitten by a bat than by a mongoose.
So I would be bitten by a mongoose trying to pet it. That would be me.
Yeah, that's how you're going to die.
Give me a baby. Yeah.
Trying to
I'm
pet
gonna be
an
trying to
ugly
pet a mongoose or a
mongoose.
fox or something stupid. Trying to feed a raccoon a marshmallow. And that's going to bite my head off. Okay,
Yeah, it is.
Or a polar bear. Like, I don't mean like drug a polar bear, but let's say we were on an expedition and they had to tag it and it's asleep. I would want to get in there and scratch it.
I don't think you would if you were actually there.
I do. I think they would smell really bad, but I still want to touch a polar bear.
And they have that weird yellow
That's
tint.
only because, they're out there eating.
'Cause
That's
they're
like the
gross.
blood being washed
Right,
off.
'cause
But
they're
they're so
gross.
cute. I love them.
They got stupid
All right.
neck.
Like, I mean, the woman got mauled in the polar bear pit because she tried to swim with one. I mean, that's how cute they are. She risked her own life. All right.
Oh my God.
So back to how you should know if you should be related. If you've had a severe exposure, such as
Related?
multiple bite wounds or exposures to the head and neck, multiple, I'm getting attacked.
If a mongoose is biting me in my head and my neck, just shoot me on sight. Shoot me
You know what they've done?
on sight.
It's like, when people sit on each other's shoulders and they put a jacket on and they pretend they're human.
Yeah.
You're going to have 18 mongooses on
If
each
I'm
other's
laying by the pool and a mongoose starts attacking me, just drown me right
Yeah, I don't think they want anything to do with us.
there. No. I
Or
hope not.
if you are a young child, when you
Oh.
are assessing the need for a PEP in a patient with a suspected exposure, consider the geographic location. Bats are a risk for rabies in every state besides Hawaii. Isn't that shocking?
That's weird.
Other high animals are found in specific geographic areas of, flip, the U.S. In many countries outside of the U.S., dogs present the highest rabies risk. So when I go to another country, please don't let me pet the dogs because I will. Consult your health department for more information. Type of animal. All mammals are susceptible to rabies. However, though I heard possums and squirrels don't carry rabies. However, certain species are at higher risk to transmit the virus to people. These include bats, raccoons, foxes, skunks, and mongoose. Behavior of the animal. Watch To Kill a Mockingbird. Rabies causes behavior changes in animals that may not be obvious until several days after they're
Until it's hit
infectious.
their goddamn brain.
Exactly. He's like staggering around. Unprovoked bites or scratches are signs of an apparent illness or often associated with rabid animals. They will be like, they're unsteady on their feet. Like
If the raccoon's out during the day.
yeah, if they're out, nocturnal animals are out during the day. They're staggering. They're like just acting erratic. Kind of like me when I haven't gotten any sleep. So the risk assessment should always be conducted by a health official. For people who have never had a rabies vaccine, I have not.
No, thank God.
The rabies PEP consists of a wound washing, a dose of human rabies immunoglobulin, HRIG, and a rabies vaccine given at the first medical visit. Then it includes a dose of vaccine given again on days 3, 7, and 14 after the first dose. I remember them saying you had to get them all in the stomach or something. It was like really painful. Pregnancy is not a contraindication for rabies or exposure. It's not a contraindication to get the PEP if you are pregnant. You're going to have to do it.
Because if it goes to your brain, you're going to die anyway.
It's going to come out.
Well, they'll be dead before
They'll
they...
be dead. Yeah. Or you're going to eat it because you're rabid.
Yeesh.
So that's rabies, which has always scared the shit out of me.
Man, I mean, thank God it's not around anymore. Like, the movies aren't showing it all the time.
No.
Wasn't there like that Pet Cemetery? Didn't they have rabies or something?
No, Pet Cemetery.
Oh, Cujo.
Yeah.
I knew there was like some...
Pet Cemetery was they were buried in bad ground, and when they came back, they were.
Do you think I was ever allowed to watch any of these?
I read it.
So it's a canyon bat. He's white.
Oh, that's why you could see him because he was white. Is he nocturnal or does he come out during the day? That's what you need to know.
I'm trying to find out. Out of all the species of bats in the world, there's only like 10 species that are diurnal, which means they come out in both.
I wonder if he's one of them, because then you wouldn't have to worry that he was rabid. It's amazing how they get.
I still think you should probably get a hotel room.
Didn't we just say it's not?
Can you just go back to California? All right. What's next on the agenda?
All right. My last one is toxoplasmosis.
Oh. Meow, meow, meow.
Toxoplasmosis is an infection with a parasite called Toxoplasma gondii. People often get the infection from eating undercooked meat. You can also get it from contact with cat feces.
Yes.
The parasite can pass to a baby during pregnancy.
Ooh. Which is why pregnant ladies cannot clean kitty litter.
Most people infected with the parasite do not have symptoms. Some people get flu-like symptoms. Serious disease most often affects infants and people with weakened immune systems. Toxoplasmosis during pregnancy may cause miscarriage and birth defects. Most infections don't need treatment. Drug treatment is used for people with more serious cases, pregnant people, newborns, and people with weakened immune systems. Symptoms. Again, most people that get infected with it don't even have symptoms.
Have it.
But if you do, it's usually like flu-like symptoms, which are fever, swollen lymph nodes that may last for weeks, headache, muscle aches, and skin rash.
Go ahead. Let it out, Laura. Just let it out.
I sound like I have
Rabies?
emphysema or something.
Yeah, you do. You sound like your name should be Marge, and you lived in
me.
Everett for 45 years, and
Yep.
you've smoked Marlboros the whole time.
The toxoplasma parasites may infect tissues of the inner eye.
Ooh.
This can occur in people with healthy immune systems.
Ooh.
Symptoms may include eye pain, poor vision, and floaters, which are like the little specks that swim around in your vision. Untreated eye disease can cause blindness.
Oh, good. That's good to know.
Yeah.
Maybe that's what's happening to me.
Maybe. It obviously has different effects on people with weakened immune systems. They're obviously going to get more seriously sick. It's people at risk include those living with HIV and AIDS, people receiving cancer treatment, and people with a transplanted organ because they're immunosuppressed.
I'm assuming they wouldn't have cats. I think I remember them saying recently a woman was coming in for a kidney or a liver, and they told her she had to get rid of her cats.
Yeah,
Because I was talking to her,
in
and
their
she was like, my pets, and they were like, and I'm like, why? And they're like, she had to get rid of her cats. I'm like, I would die of hepatitis C before I'd get rid of my cats. The poor thing.
In addition to serious eye disease, toxoplasmosis can cause severe lung or brain disease for the person with weakened immunity. But rarely the infection can show up in other tissues throughout the body. A lung infection may cause breathing problems, fever, and cough. If it gets into your brain, it gives you encephalitis, and the symptoms include confusion, poor coordination, muscle weakness, seizures, and change in alertness. Toxoplasmosis can pass from a mother to the fetus during pregnancy. This is called congenital toxoplasmosis. Infection during the first trimester often causes more severe disease. It may result in a miscarriage. For some babies with toxoplasmosis, serious disease may be present at birth or appear early in infancy. Medical problems may include too much fluid in or around the brain, so they have hydrocephalus, severe eye infection, irregularities in brain tissues, an enlarged liver or spleen. Symptoms of severe disease vary. They may include problems with mental and motor skills, blindness or other vision problems, hearing problems, seizures, heart disorders, jaundice, and rash. Most babies with toxoplasmosis do not show symptoms, but problems may show up in later childhood or teenage years.
Wow.
And those include return of eye infections, problems with motor skill development, problems with thinking and learning, hearing loss, slowed growth, and early puberty.
Interesting.
Yeah. It's so weird. Like they might not show any signs, and then as a
14,
teen,
they're like all screwed up.
The cause is a parasite that can infect most animals and birds. It can only go through the entire cycle of reproduction in domestic and wild cats.
Wow.
So it is only reproduced in domestic and wild cats.
Who have killed birds.
These are the main hosts for the parasite. So the eggs, when it's in the middle stage of reproduction, that is usually found in cat feces. And this immature egg allows for the parasite to make its way through the food chain. It can pass from soil and water to plants, animals, and humans. Once the parasite has a new host, the reproduction cycle goes on and causes an infection.
Does a cat get sick from it? Does it say?
I don't know if the cats get sick from it. I don't think
Is it
so.
like-
It didn't say that.
Not
But
what we did with the ducks, and the ducks kept reproducing.
yeah,
that-
I think it's
they
just
never got
something-
sick.
It doesn't seem like it's like if your cat's weird,
Right.
like it doesn't say anything like that. If you're in typical health, your immune system keeps the parasites in check. They stay in your body but are not active. So you might
I
have
don't even want them in my body.
toxoplasmosis.
I probably do.
This often gives you lifelong immunity.
Oh.
Like if it's in you and you're healthy,
I'm never going
then
to get it.
you're not going to get sick from it.
Never going to get it. Never going to get it.
If you're exposed to the parasite again, your immune system would clear it out. If your immune system is weakened later in life, parasite reproduction can start again. This causes a new active infection that can lead to serious disease and complications. People often get it Toxoplasma infection, one of the following ways. Cat feces with the parasite. Cats that hunt or who are fed raw meat are more likely to carry toxoplasma
Max
parasites.
He's like a hunter
Yeah.
extraordinaire.
You may get infected if you touch your mouth after touching anything that has been in contact with cat feces.
Why would I do that?
This may be gardening or cleaning a litter box.
I don't do that. I immediately wash my hands.
I would hope so.
In fact, I cleaned it today. I probably have toxoplasmosis right now, and it's in your cup.
Yeah, probably. You can just take that on home with you. Contaminated food or water. Undercooked beef, lamb, pork, venison, chicken, and shellfish are all known carriers of the parasite. Unpasteurized goat milk and untreated drinking water also may be carriers.
You don't have to worry about me ever drinking unpasteurized goat milk.
No, you don't like goat anything.
I don't like goat anything.
Unwashed fruits and vegetables. The surfaces of the fruits and vegetables may have the parasite on them. Contaminated kitchen tools. Parasites may be on cutting boards, knives, and other utensils that come into contact with raw meat or unwashed fruits and vegetables. Wash your fruits and vegetables before you use them.
Always.
We have a friend that doesn't wash any fruits and vegetables before she uses them.
That's disgusting.
Except I did say something to her years ago, and so if she brings any into work, she does wash them before serving them. Infected organ transplant.
I don't even know what to say to that.
You knew that. You
I
must have
don't.
forgotten.
I don't, and now I don't know who it is, so you're going to have to tell me when we're done recording, because I just think I threw up in my mouth a little bit.
Infected organ transplant or transfused blood. Rarely, toxoplasm parasites are passed through an organ transplant or blood transfusion. Anyone can be infected, but people at a higher risk of getting it. Again, they're infected with HIV/AIDS. They have chemotherapy, getting chemotherapy, taking high-dose steroids, or drugs that prevent the rejection of transplanted organs. To prevent getting toxoplasmosis, wear gloves when you garden or handle soil. Wear gloves when you're working outdoors. Wash your hands with soap and water afterwards. Don't eat raw, undercooked meat. Use a meat thermometer to make sure meat is cooked enough. Cook whole meats and fish to at least 145 degrees Fahrenheit and let rest for at least 3 minutes. Cook ground meat to at least 160 degrees Fahrenheit. Cook whole and ground poultry to at least 165 degrees Fahrenheit. Don't eat raw shellfish. Do not eat raw clams, mussels, or oysters, Mike.
Too bad. Too bad. I'll take my I'm immune to it because I have the cats.
That's right.
So I can eat as many oysters as I want.
Particularly during pregnancy. Do not eat raw anything during pregnancy.
You know the Myrtle Beach oysters had toxoplasmosis.
Oh, 100%.
Like,
you
you
guys
know that.
They were killed with alcohol.
That is true, but you still know those were the nastiest oysters.
Well, you both have cats. You grew up with cats and she has
So
cats.
we're immune. There you go.
Wash kitchen utensils thoroughly. Wash cutting boards, knives, and other utensils with soapy water after contact with raw meats or unwashed fruits and vegetables. Wash your hands thoroughly before and after preparing foods. God willing, everybody does this anyways. Wash all fruits and vegetables before eating, peeling, or cooking. Do not drink unpasteurized goat milk. During pregnancy, do not drink untreated water. Cover your children's sandboxes. Cats think they're big litter boxes.
I got rid of those real quick.
Yeah, I mean, you have to cover it and put bricks on.
It's just disgusting.
Yeah, that they think it's a litter box. They're going to poop in it. And for cat lovers, these tips are for cat lovers. If you're pregnant,
Of all the years. I'm not pregnant, so you don't even have to read them.
or otherwise at risk for toxoplasmosis, take these steps to protect yourself. Help your cat stay healthy. Keep your cat indoors. Feed it dry or canned cat food, not raw or undercooked meat. Avoid stray cats or kittens. Why do you have to tell people this?
Because if you see a stray kitten, you're taking it in, taking it to the vet, getting it cleaned up. And
No, I would say it has rabies or fleas.
This is the cat distribution system. People go to breeders for dogs, spend $12,000 on a dog, and they get their dog. Cat owners get their cats out of the trash or behind a dumpster.
They're
or they shove the back
fleas.
door.
They're dirty.
You take it to the vet. You get it a flea bath. That's how we all get our cats. Nobody's ever counted on the cat they have. It has happened to your life.
Oh, God.
It's the cat
Well,
distribution.
avoid them.
I would never.
If you're pregnant or at risk,
well, I'm
avoid
never going to
them.
be pregnant. I could be at risk because,
And
at
do
my
not
age.
get a new cat when you're pregnant.
True.
Have someone else clean the litter box. Clean the box daily if possible. If someone else can't clean it, wear gloves and a face mask to change the litter, and then wash your hands well. But try to have someone else change your litter box for you.
I didn't know that. Pregnant women shouldn't do it.
Do not go near cat poop if you're pregnant.
Is this the disease that attracts mice too? Like it makes mice attracted to cat pee or poop or something?
What?
Yeah, there's like some disease.
Is it the Hunter virus you're thinking of?
No, and it gets in their mind to make them want to go near cats, and the cats will eat them.
Never heard of that, Mike.
Yeah, no, it's a real thing. I'll look at it.
Laura, he's going rabid.
Please take him with you.
It's happening. It's happening. All right. I'm following this up with ringworm.
Ew.
Something else I was also
Wrestling
fascinated with
mats.
as a child.
Wrestling mats.
Yeah. So this is something you can get from animals, but you can get it from a million other places too. And as
Wrestling mats. You can get them from wrestling
you can get
mats.
them from a lot of places. As a kid, I thought it was an actual worm that people had, and it really made me nauseated. But it's not. It's a fungus. It's not a worm that causes ringworm. Fungi thrive in warm and humid areas such as locker rooms and public showers. It's common, and it's a contagious skin infection. Gets its name from the red, itchy, ring-shaped skin plaque, and it spreads easily through close contact. You can get ringworm from contact with an infected person, animal, or object. Mm-hmm. It goes by different names depending on the body part it affects. On your body, it is called tinea corporis. This type of ringworm affects your arms, legs, torso, and face. It's treated with antifungal medication available over the counter or as a prescription. It can also be known as athlete's foot, jock itch, scalp ringworm, hands, which would be tinea manum, beard, tinea barbae, toenails or fingernails, tinea unguium. All right, toenails or fingernails, okay? Your nails become thick, discolored, and deformed. Mm-hmm. If it's on your beard, it appears on your neck, chin, and cheeks. Yeah. And they may become crusted over or filled with pus. That's attractive. Okay. What does it look like, Laura? It typically begins as a flat, discolored patch that may appear red in lighter complexions and brown in darker complexions. And it has a ring-like or circular shape with raised, scaly border. Mm-hmm. It can affect people of all ages. You are more at risk if you have a weakened immune system or autoimmune disease like lupus. You have high contact sports such as wrestling. This is called tinea gladiatorum. You know, for the gladiators. Yeah. Sweat excessively. Hyperhidrosis. Use public locker rooms or public showers. Or you work closely with animals that might have ringworm. How common is it? It can affect 20 to 25% of the world's population at any given time. Signs typically appear between 4 and 14 days after you come in contact with the fungus that causes ringworm, including, which we've already discussed, circular ring-shaped scales, flat patches with raised red borders, itchy skin, hair loss, or bald spots in the affected area. The type of fungus naturally lives on your skin, hair, and nails. However, when their environment gets hot and damp, it starts growing uncontrollably. You can get this infection anytime your skin comes in contact with the ringworm fungus or somebody else's ringworm fungus. Yeah. It is contagious. It can live on your skin, on surface, and in soil. It is spread skin-to-skin contact with the person who has it, contact with an infected dog, cat, or animal, any kind of livestock, contact with contaminated surface such as a locker room floor or sweaty gym clothes, sharing objects with an infected person or animal such as a brush towel or bedding, or contaminated soil. How is it diagnosed? They'll look at your skin, assess your symptoms. They may scrape the area to look at the cells under a microscope, and voila, you're confirmed with ringworm. How is it treated? Over-the-counter prescription antifungal medications are available to treat your ringworm. Antifungals come in various forms like creams, gels, and powders. You can have oral medications. You can do antifungal shampoo. I'm not even going to go and try to explain.
No.
Home remedies. I can't wait to hear what the home remedies are. Are you ready? We got some home remedies. Fun. Boric acid. Home remedies like apple cider vinegar or tea tree have little to no benefit. Yep. Apple cider vinegar may cause open sores or inflammation. And tea tree has antifungal and antimicrobial properties, but they don't work. So basically they're saying don't use at-home remedies. You can just disinfect with Lysol. Remember Lysol? Yeah. Nobody really uses the old gold can Lysol. Yeah. Do you remember that? It smelled like shit.
Yeah, it was terrible.
We used to have this girl in first grade. She'd throw out every fucking day.
And they would come in with the thing.
And they'd come in with the sawdust and the Lysol. I can't even smell it. The smell of Lysol. And you remember those nasty blue things that went in the toilet? They smell
we didn't
like
have
shit.
those, but other people
But
had
have you
those.
ever thrown up in the toilet with that in it?
No.
I can't even. I look at one of those and I get nauseous. Like,
no, we never had those in our toilet.
I didn't have I'm sure I was at somebody's house and threw up because that smell, like,
it was.
Why would you put that? It had to be just complete, like, fucking chemicals. Oh, it's disgusting. They're disgusting.
The cakes,
Yeah. Ugh. That and the fucking Lysol gold
That
can.
Lysol. I still don't like the smell of any Lysol spray.
But the gold can
But that's
was
the worst.
awful. All right. So you can use gold can Lysol, the bleach, to remove the fungus. You know what I'm drinking tonight? Water. That's what I'm drinking tonight. Wash your clothes, sheets, and towels in hot water and detergent to prevent ringworm from spreading.
Mm-hmm.
So that's it. It might take up to about 6 to 12 weeks for it to cure. Keep the affected area clean and dry. Apply your lotions and ointments, and avoid touching the area, and wash your hands before touching other areas of your body.
You made a good idea.
And there you go. Ringworm.
I cheered at, so Mike is right, and toxoplasmosis causes altered predator-prey relationships. Infected mice may lose their fear of cats, making them more likely to be eaten. This benefits the parasites as it needs cats to complete its life
That's
cycle.
so bizarre, huh?
That
How
is
do you know?
bizarre.
He's going rabid. He knows weird
See,
shit.
he knows shit.
See?
It's
Weird
this
shit's
altered
happening. It's
predator
happening. I gotta
prey
get out of
thing.
here, Laura.
Yeah.
I gotta go home before I get infected.
I cheered at an all-boys high school, and obviously they had wrestling, and we would cheer on the wrestling mats,
How
like
much ringworm
to
did you get?
stunt. Well, no, we always wiped them with bleach, like always, like we had to clean them up and everything. In our heads, we were like, if our heads touch these, it was just, I don't know why we always pictured ringworm just in your hair. You know, like you would always see
like
it on
scabies or
boys'
something.
hair. Like, we were like, if our head touches these mats, we're going to get those ringworm circles, and we're going to lose our hair, and it's going to be like, where those circles, like,
You know
we're going to
what?
get a ringworm circle. I never thought of it anywhere else in my
80s
body.
women didn't think of that because with all the Aquanet
Yeah,
out
nothing
there,
was
my
getting
hair
to
wasn't
that.
touching shit.
Yeah.
All right.
We were petrified of getting ringworm from the wrestling mats.
Well, that's our Valentine's Day episode. You know, the love of our pets. I'll go to bed tonight and I'll have 2 cats in the bed with me, and I love it. Every second of it.
I hope you don't get toxoplasmosis.
Well, so again, we got some emails. Maybe we'll read them in the next episode.
Yeah,
Did you have
we'll read
one
them in the next.
closely by? Well, we have some emails. We'll read them in the next episode. We appreciate the emails. I love hearing from you guys. Keep them coming.
Mm-hmm.
And we will see you in 2 weeks.
Bye.
Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.